Are you wanting to look and feel your best for summer? Well, if so, then Dr. Ward can help. It is time for Doc Talk with Dr. Ward. He's a facial plastic surgeon, and I always love chatting with you because I learn new things all the time. So good to see you.
Great to be here.
So we're going to take some viewer questions as well a little bit later, but before we do that, what are some of the things people can do to make themselves look and feel fabulous?
So most of the time when we talk about summer treatments, it's due to the fact that we're out on the boat, we're at the beach, there's more skin showing. So some of that's like insecurities with pigment. You know, if we've got pigment on the chest, on the face. What can we do to try to treat that? So there's lots of things you can do. One is just making sure that you're always wearing your sunblock. That's number one.
I didn't in my 20s.
So and then, you know, taking care of your skin, like the topical treatments that really do a good job at helping treat those areas. Okay. But then also getting the laser treatments. There's a lot of energy-based devices like IPL and lasers that can help kind of remove some of that pigment. Don't forget that the pigment is usually caused by the melanocytes. The melanocytes are the skins in our cells that produce melanin. That's what causes the pigment. Okay. And whatever we can do to try to help treat the results of that is going to help decrease that.
And that's what's so cool about the lasers is you can get rid of those spots, which I've been doing, and I've done, you know, laser treatments over the years, and it's amazing the technology that can remove the damage we did when we were younger.
It is. It's really amazing, but you have to be careful. It's not just like one laser or one thing, one treatment fits all.
Right.
Because there are some times when the laser's causing inflammation in the skin, and it can actually exacerbate a problem. So you need to make sure that you're getting a treatment plan by someone who really knows what they're doing.
Yeah, absolutely. Like for me, with melasma on my face, it's a very different laser than what you would use for IPL or something, correct?
Absolutely, absolutely.
Yeah, well, and that's where, if you are someone like me that was in the sun a little bit too much when you were younger, you can have those removed, and also cool sculpting, things like that as well.
For sure. So the other thing is like, well, what about our body? You know, we're at the beach. We're not wearing a big bulky sweater or whatever.
Right. We wish.
So things like cool sculpting helps. Cool sculpting on average eliminates 20% of fat in the treated area. But then other things, like we have a device called Form Sculpt EM, which uses electromagnetic energy to help contract the muscles. So you can, in like a 30-minute treatment, you can get like the equivalent of doing 30,000 sit-ups.
Well, okay. Sign us all up then. Okay, well, Dr. Ward, let's now, we've had some different viewers write in questions. So our first question is it true that if I use the same skincare product daily, that over time it will stop working for me? Is that true?
Almost certainly not. You can keep using the product and it will keep working. You may have to change things up a little bit, depending on the condition, you know, depending on the season. But in general, these ingredients work, and it's not like you get a tolerance for it or that it stops working. It's not like an antibiotic that might become resistant.
Got it. Okay, that's good to know. Second question is, what treatments can and cannot be done during the summer?
So during the summer months, we have historically always thought, don't do treatments where you're going to get a lot of UV exposure. As we've learned more, we realize that, well, actually you get UV exposure year round, especially living in a place like Utah.
Absolutely.
Where we, you know, it's really nice, where the winter has nice, bright and sunny days. But we have bright and sunny days, and that can, you know, that means UV. So there are some treatments that would maybe be better avoided if you're getting high UV exposure. But frankly, we're gonna get that in the winter or the summer. So I think the real key and the real message is wear your sunblock. You know, after your treatments, wear your sunblock, protect your skin after, and then you can do kind of whatever treatment you want.
Yeah, it's become routine for me as well. Every single day, pop that stuff on and I'm feeling a little bit better. So, Dr. Ward, always great talking with you. If people have questions, want to get in touch with you or your team, how do they do so?
Yeah, so check out Form Derm Spa online or on social media.
Fantastic. Thanks so much, and we'll see you next week. If you have a question related to plastic surgery that you would like answered in one of our Doc Talk segments, email doctalk@wardmd.com and we will answer it so that you know what to do. We will be right back after this break.